Hi, my name is Shelby Norris. This is my week 14, chapter 12 and 15 discussion. This week we have 4 different questions. The first one is, how was your experience with telemedicine? I really like telemedicine. I've been using it quite frequently more recently. My parents have Cigna, so I get to use their insurance, so I can go on there, and a couple of times I've talked to a doctor with just minor things. It was a 15-minute experience, really easy, and he was able to send me a prescription over to my CVS. Super simple process. And that leads me to my second point with why I like telemedicine. I have the CVS app, so when I get my prescription sent to CVS, I can just go on there, and it's really simple, really easy. Click of a button to just get my prescription refilled instead of having to call or go into my healthcare provider and all that nonsense. So I think that telemedicine is just really beneficial and accessible. I do think there's some drawbacks with it. One is the older generation. I think they're not as tech savvy as us for the most part, so sometimes telemedicine can be a little bit more difficult for them. It'll probably take a little bit more time for them to catch up and, get with the program. But I also think another drawback is if people use telemedicine a little or more flippantly than they should be. Like if they are trying to go to a doctor about a problem that's a little more complex or shouldn't be examined over the internet, I think that's when telemedicine can be a little harmful, just because you might be getting wrong diagnosis since your doctor can't actually see you in person. And then number 2 is, what do I think the future of technology is in healthcare? I think that AI is already a huge part of our future and current state. So I think that'll probably be very involved. AI will be very involved in the future too. One way I think that AI could help is with mental health. If they did like AI therapists, where you can go on and just, talk to someone, talk to an AI on the internet for mental health. That could be really cool. And then I also think that probably in the future, I think we're going to start figuring out cures for like cancer, or like maybe if they were able to even like get easier ways to scan for cancer cells, or cancer clumps, tumors, whatever they are. I'm not sure. Cancerous things. And I think that'd be really cool if we were able to have that in the future. What's one topic that I wish we would have covered in class but did not? I always thought about the fact that certain people who get more into medicine or who study certain things in medicine start to change their opinions as they learn more. It'd be cool to just go over that and discover a little bit more on why that happens. The reason I thought about that is because I have a friend who her mom is a chiropractor, and since she became a chiropractor, she started getting really weird about like vaccines and like different medicines that her family would take. So trying to understand that dynamic of how much you know and how that changes your opinions or thoughts on medicine would have been cool. And then one question related, I wanted to ask you what you thought about KSU's mental health services and what they offer at the school. I did a big project on it for my team communication class, so I wanted to see your opinion on whether you think that we are doing that successfully or whether we need to implement more. Yeah, that's about it, but thank you so much. Okay, bye.